Thank you for joining me today. Because of the work that I do in Southwest Florida, assisting seniors that find themselves in skilled nursing, and it's clear to them their healthcare insurance is no longer going to cover their needs for their long-term care. Oftentimes they look to understand the government benefits and the complicated process for qualification, and that's how I come to meet so many families. And it's through that work that has led me to want to have the conversation with the adult children and helping them to navigate this so it's easier, and frankly, have this conversation earlier with their parents to make it easier on all involved. Now, the title of this may have given you a chuckle, but much like the talk that we had with kids initiated by our parents about the birds and the bees and that uncomfortable conversation, it's not all that different than the one that we need to have as the adult children of aging parents, where we're talking about their savings and their health care and their long-term care planning. It can be awkward, but it's essential. And it's this conversation that I'm going to be walking through here. Also, this is useful for my professional peers that are helping family members navigate the aging process for their parents, while, of course, juggling their own concerns about their future, and in some cases, while raising their own children. That's called sandwich generation for that reason. But this talk is for my professional peers as well. So let's just talk about where to start, right? So starting the conversation is the hardest part. It helps to lead with concern and not control. It helps to frame the conversation with empathy, and that isn't about taking over, but it's about understanding what's in place and what support might be needed in the future. So you want to touch on some key areas like savings, like their healthcare coverage, any long-term care options or insurance that might be in place, while of course also respecting their autonomy. So those are a couple places to start the conversation. Now, shifting gears and just restating why this conversation is so important, because planning is always better than reacting in a crisis. These conversations help us to avoid financial emergencies and confusion later on. It also builds a stronger understanding between generations about money values and expectations and priorities. And more importantly, it gives the families the opportunity to act together with dignity, not desperation. So really talking about the prevention over crisis, the general support and understanding, and just bridging those gaps. There's 3 different methods to have this conversation. We'll talk first about asking for advice. So one of the least confrontational ways to start is simply asking for advice. Many parents still see themselves as providers, and they appreciate being valued for their wisdom. So you might say something along the lines with, how did you decide on your retirement savings plan? Or what help did you have when you were choosing your Medicare coverage? This sort of opens the door a little more gently while moving into deeper topics. This works particularly well in more traditional families. Shifting gears to another method, I myself did not grow up with a very traditional family, so I know that first one wouldn't come across as authentic in my situation. So this one might be a better method for different kinds of family dynamics. So it's really leading with your own story. So, hey, I just updated my power of attorney, and then I realized I didn't know where yours is. I've been learning about long-term care insurance, and have you looked into that? When we share our own planning, it normalizes the topic and helps the conversation feel mutual and not one-sided. A third method is really anchoring off current events, and that perhaps is fairly easy these days when we're hearing about things in the news about cuts and how it may or may not affect Medicaid and Social Security and so forth. So the news can really be a perfect opening for the conversation. You could simply just say that with all the talk about Medicare and Social Security changes, I've been thinking about how we're all affected. And using that timely headline to spark a dialogue is a way to deflect the pressure, perhaps, and make the conversation feel a little less personal and a little more proactive. So this is just sort of touching on a few items here, and hopefully you're walking away with a few key takeaways for effective money conversation. But first and foremost, if you can start the conversation early versus waiting for a crisis, that's particularly helpful. Be patient. This will take several conversations to unfold. Customize your approach. There's no script that fits every family, of course. And taking the initiative, it shows love and not intrusion. Most parents aren't necessarily avoiding the conversation. They're just waiting for someone else to go through it first. So hopefully this has been helpful. My name is Hillary Hayes. You'll see a link here to the QR code if you want to schedule a follow-up conversation. And thanks so much for listening.